Hi, welcome to this presentation. My name is Khalid Ahmed. I'm also known as Abdul, and I'm the Senior Trial Manager for the CALIBRE trial. Today's presentation, I'll be talking to you in regards to screening, consent, the three different types of recruitment pathways, and randomization. This presentation will take around 15 to 20 minutes. So to start off with, I'll talk you through the objectives of CALIBRE. So the main primary objective of CALIBRE is to compare a non-selective beta blocker such as carvedilol versus variceal band ligation in preventing any variceal bleeding within the first year of randomization in patients with cirrhosis and medium to large esophageal varices that have never bled. So the three key aspects to consider in the primary objective is any participant that have had treatment for variceal band ligation or has treatment with a non-selective beta blocker will not be able to take part in CALIBRE. So this is primary prophylaxis. Also, the second thing is anyone that has never bled before, they need to have either medium or large esophageal varices. Moving on to secondary objectives, we want to investigate the effect of carvedilol and variceal band ligation on survival. We want to have a look at development of other complications of cirrhosis and also adverse events. So in terms of adverse events, this would be recorded on the follow-up CRFs, such as the 4 weeks CRF for the carvedilol arm, 6 months and 12 months. There is a presentation which is dedicated to serious adverse events and adverse events pharmacovigilance, and that is also saved in the Birmingham Clinical Trials Unit website, the CALIBRE website. Please do visit that, where you did pick up on this presentation, and we have other sort of short snippets of other presentations in regards to CRF returns and so on and so forth. We want to also assess the cost effectiveness, patient preference and use of alternative and crossover therapies. Again, another presentation is dedicated to crossover therapies withdrawals. So in terms of the study design, it is quite a relatively straightforward study design. A randomized controlled parallel group trial. We are in our full phase of our trial, and the 12 months internal pilot has completed. It's open label. The two interventions are quite distinct and different, carvedilol versus variceal band ligation. Hence, we haven't really blinded, or we can't possibly blind this trial interventions. We're looking for over 66 UK sites taking part in CALIBRE. At present, we have the devolved nations taking part, such as Scotland, Wales, and the Northern Ireland. And we have the remaining scattered around England. We want to recruit around 2,630 participants across the recruitment phase, and every participant would be taking part in for 12 months. In terms of the trial summary, it's probably not too clear in this slide, but I've broken down the inclusion and exclusion criteria in the next few slides. And also I'll talk about the pathways in more details, but just briefly explain the trial summary. There is 2 inclusion criteria. If the participant it has met the first inclusion criteria, and the first inclusion criteria is liver cirrhosis as defined clinically radiologically with transient elastography, where the liver stiffness in the clinician's opinion supports a diagnosis of cirrhosis or an histology. So once that criteria is hit, then the participant obviously would need to have you need to obtain consent, and once the consent is being obtained, then you do the diagnostic endoscopy, which is the index diagnostic endoscopy. And that would be, they need to have medium or large varices that have never bled as defined in the BSG guidelines. Providing these exclusion criteria are not met, then you randomize them, and they fall in the 1-to-1, either the VBL arm or the carvedilol arm, and then the follow-up visit, the 4 weeks, is just for the carvedilol arm, and then the 6 and 12 months. For the VBL arm, it's just the baseline, obviously, 6 months and 12 months. And I'll talk to you in more details in the pathway in the next few slides. So I'll just move on to the next in terms of the inclusion criteria. So as I've just mentioned, the liver cirrhosis as defined clinically radiologically with transient elastography, where liver stiffness in the clinician's opinion supports a diagnosis of cirrhosis or in histology. So once that criteria has been met, then the second criteria would be only met after the index diagnostic endoscopy. And that would be if they have medium and or large varices that have never bled as per defined in the BSG guidelines. So these exclusion criteria are not met, so they can't be below the age of 18. So we're only looking for adults over the age of 18. There is no upper limit of the age, so anyone 18 plus. Pregnant or lactating women, so any mothers that are breastfeeding or planning pregnancy, for instance, or pregnant, will not be eligible to take part in CALIBRE. If they do fall pregnant within the 12 months that they after randomization, then they would need to be withdrawn, and there is a separate CRF, the pregnancy outcome CRF, that would need to be completed alongside this change of status CRF. Please consult ourselves, the clinical trials team, in what to do next if you do find someone that has become pregnant after randomization. The partners of the participant is absolutely fine. If they fall pregnant, that's absolutely fine. It's just the participants, if they fall pregnant, then they need to be withdrawn. The other exclusion criteria is known intolerance or contraindications to beta blockers, including asthma. So any asthmatics would not be eligible. Anyone that, excuse me, contraindication to beta blockers will not be eligible. Unable to give informed consent, so they need to have mental capacity to give it full informed capacity. Acute alcoholic hepatitis, this is of any grade, will be excluded. Current or past history of non-selective beta blocker, so for instance in the past, if a participant has had exposure to carvedilol, nadolol or propranolol, even if that is for a day, even if for a short amount of time, even for they've had it 15 years back or a length of time back, they will not be eligible to take part in CALIBRE at the present moment. Anyone with current or history of varicose band ligation, again, they wouldn't be able to take part in CALIBRE. It's a primary prophylaxis treatment, so we're only looking for people that haven't had this treatment before. Anyone with the previous organ transplantation, presence of malignancy or systemic disease that significantly affects 1 year of survival, so anyone that would not, in the clinician's opinion, would not make it for the next 12 months survival, then they would not be able to take part in CALIBRE. And the last exclusion criteria is patients with surgical or radiological portal synthetic shunts, such as TIPS, would not be able to take part in CALIBRE. So in terms of recruitment, a medically qualified doctor who is delegated by CALIBRE must confirm participant eligibility. So going back to the eligibility criteria, the inclusion and exclusion criteria, that is in the randomization form. The latter part of the first page and the second page is the inclusion and exclusion criteria. So these need to be confirmed by a medically qualified doctor. Nurses would be able to take consent, they would be able to randomize, but that eligibility section needs to be confirmed by a medically qualified doctor as stipulated by MHRA. There are three routes of endoscopy, pathways of recruitment. The first one would be planned endoscopy, second would be outpatient clinic referral, and the third would be inpatient referral. I'd like to advise all sites that no pathway is preferred for CALIBRE. Whichever pathway fits best for purpose for your site, please adhere to that. It is within the protocol to recruit from any of these pathways. So there is no preference for CALIBRE to recruit from pathway 1, 2, or 3. So only participants who have not yet started treatment will be eligible, going back to primary prophylaxis again. So if you just cast your eyes onto figure 1, protocol version 2, page 31, obviously with subsequent protocol amendments, please do refer to the CALIBRE protocol at that point in time. So I'll just talk you through the consent pathway. So for instance, with Figure 1, the consent process for this would be participants that have not had a diagnostic endoscopy. So we don't know if these participants have had medium to large varices. If they have any varices, they may be cirrhotic, but we don't know their condition of their varices, for instance. So these are on the surveillance list. You would be sending out a appointment letter, invitation appointment letter, to these participants. And with that, you would be sending out the CALIBRE main patient information sheet. So once the participant has received the appointment letter and the main patient information sheet, they would come to their diagnostic endoscopy appointment. And at that point in time, a research team member from your site would approach that participant. They would go over the patient information sheet if need be. If the participant is happy with the patient information sheet, if the participant's questions have all been answered satisfactorily, then if you could ask the participant to sign the consent form. That's the consent, CALIBRE consent form. At the moment it's version 3, but obviously over time it may change to a subsequent version. So the consent form would be completed by the participant and the staff member that would be taking the consent. Once that's been completed fully, then the participant would be taken into the diagnostic endoscopy room. We would ask for an EQ5D5L to be completed prior to taking them to the endoscopy room before they're sedated. So the patient reported outcome measure would be fully completed with the full senses of the participant at that point in time. So once the EQ5D5L is completed, the consent has been taken obviously before, the participant would have their diagnostic endoscopy. In the diagnostic endoscopy room, once the diagnostic endoscopy has been completed, then you would find out if they've got medium to large varices, for instance, or no varices. So if they have medium to large varices that have never bled, then you would randomize them, and it's a completely straightforward randomization system, and I'll talk about the randomization system in the next few slides. It's online. So once you randomize them online, they would either fall in the VBL arm or the carvedal arm. If they have small varices or no varices or orthopathology or cancer or any other issues, then you would not randomize them. There would be a screen failure. And then please do complete this screen failure in the screening log, for the CALIBRE screening log, which we request preferably every month. That if they've got no varices, then they have no varices. If they've got small varices, they have small varices. And then you revert back to your standard of care as per NICE and BSG guidelines. If they have medium to large varices, then obviously randomize them. They fall in either arm. The carvedal arm, you prescribe them 12.5 milligrams per day, first month from your site, and the remaining 11 months from their GP surgery. Please do send the REC approved GP letter with the letter, your hospital letter that you send to the GP, so the GP is aware that this participant is taking part in CALIBRE. Same for the VBL as well. You send the same REC approved letter with your hospital letter, so the GP is aware. So I'll move on to the next pathway. So majority of sites at the present moment are taking figure 1 or route 1 of the pathway, whereas other sites are looking at, which is in figure 2, protocol version 2, page 33. So this is when participants have already had their diagnostic endoscopy, and we know that they have medium to large varices that have never bled. So these participants are eligible, providing they don't hit the exclusion criteria, any other exclusion criteria. They could be straight away randomized to CALIBRE, as long as they have read the PIS and they have consented. So once they have consented, then they'll take part in CALIBRE. Just to mention the green boxes here, this is for the qualitative study. So this is part of the qualitative study that took part in the pilot. This does not apply anymore. And this has been clarified in protocol version 2 that any qualitative aspect of CALIBRE does not apply. So please do disregard the qualitative aspects in the 3 pathways. So once this participant has been randomized, again, it's carvedal 12.5 milligrams per day, first 4 weeks through the hospital, the remaining 11 months through their GP community pharmacy. and then VBL as per BSG guidelines. So they'll be banded. On to the next slide. In terms of the protocol version to page 35, so this is very similar to figure 2, pathway 2, where the participant has already been had their diagnostic endoscopy, but these are participants that are already in hospital, so these are inpatients. So we're trying to capture all routes of or avenues of recruitment. Just to mention, the timelines in terms of for all 3 pathways is the same in terms of after randomization. The first 4 weeks for the COVID alarm would be the hospital, the remaining 11 months would be GP or community pharmacy. For the VBL arm, as per trust guidelines in terms of or BSG guidelines in terms of banding. So you would have probably 2 to 4 sessions until eradication of banding. So some participants may have up to 6, 7, or even more banding sessions. So you keep on banding them until they're eradicated. And then there's the follow-up visit for both 6 and 12 months. And at the 6 months, you fill in the get the participant to complete the EQ5D5L, and at 12 months, get the participant to complete the EQ5D5L. There's only a 4-week visit for the COVID alarm. That's the adverse event visit. So our recommendation would be after you randomize the participant, if they fall in the COVID alarm at that point in time, book in the 4 weeks appointment. For the 4 weeks appointment, there is a plus or minus 1 week window, so it's quite tightly sort of designed. So please do take in consideration that 1 week. Whereas the 6 and 12 months for both arms, the visits are quite generous in terms of we have a plus or minus 2 months windows. So, and the 6 and 12 months are a part of standard of care. So please do align them with your standard of care visits for that participant. Moving on to informed consent. So the participant must sign and date the latest version of the informed consent form, and a copy of the informed consent form must be given to the participant. A copy should be sent to BCTU and filed in the participant medical notes. And that please keep the original informed consent form in the investigator's side file. This is just an example of how an informed consent form looks. Over the time, we have changed the consent form, so it's virtually very similar. But on the top right, please do put your trust logo. Please do fill in the site name, principal investigator name, the participant trial number. The participant trial number would be given retrospectively, so please do take that after randomization, and then please do jot that down on the consent form. Please do put the correct version number and then the initials of the participant name, date and signature, and obviously the person that's taken the consent. Again, the consent could be taken by a research nurse or anyone delegated by the site that is appropriately trained for the duty, such as they should be on the delegation log, they should be on the training log, they would have a GCP, and we should have a copy of their CV. In terms of randomization, so the randomization has been developed by our programmers at Birmingham Clinical Trials Unit. It's completely online and it's secure. Unique username. The username is always your email address, and the password is a password that you would set once myself or our data manager would be sending you a link. You would set your password. It's available 24/7, 7 days a week, and if that does fail, a toll-free number is on the randomization form, so please do call that. It is manned from 9 till 5 UK time, except obviously for bank holidays and University of Birmingham closed days. So this randomization system takes on average 5 to 7 minutes maximum, but normally it takes 3 to 4 minutes to complete. It really depends on practice in terms of how quick you learn how to do the randomization form. It leads me to the next few slides in terms of a test system, which I'll talk about just for yourselves to practice on. So randomization, for instance, may begin after participant eligibility has been confirmed and an informed consent has been received. So a randomization form must be completed before a trial number can be given to the participant. And if data items are missing, randomization will be suspended but can be restarted once the information is available. So this is just a screenshot of how the randomization main screen looks like. The blue URL is the live system. So once you log into that, you can randomize someone live. However, the red URL is a test system where you could log into that with the generic login details and the password, and you could test how quick it takes to randomize a participant. So please complete the randomization form first of all, and then jot all the data on the randomization form to the online system. That would give you a participant number and also the allocated intervention. So the treatments, just briefly, the two treatments are obviously, it's a one-to-one randomization. So carvedilol is a non-selective beta blocker, and participants will be given 12.5 milligrams per day for the first 12 months. Obviously, the first 4 weeks would be given from the site, which is yourselves, the hospital, and the remaining 11 months would be given by their GP or community pharmacy. They'll be seen in the follow-up clinic at 4 weeks to assess for short-term adverse events, and then at 6 months and 12 months. For the variceal ligation arm, varices are abandoned at regular intervals. This is usually 2 to 4 weekly until they are eradicated. After successful eradication of varices, further endoscopies should be carried out as per local standard practice. Any recurrent varices, for instance, medium to large varices, are treated with further variceal band ligation, usually 2 to 4 weekly intervals until eradication, and then offered repeat endoscopies as per local standard practice. And obviously the 6 and 12 months visits would be incorporated within the standard of care visits. In terms of contact details, this is the direct numbers for contacting us at the Birmingham Clinical Trials Unit. There's the fax numbers. Obviously the fax numbers are phasing out throughout the trusts. This is the email address. Please do email the CALIBRE trial box and also email myself with any queries. This is our website. So in the website, there are other small presentations such as CRFs, completing CRFs and pharmacovigilance. And this is the address to send any CRFs to. Thank you very much for listening to me. Any sort of questions or anything, you could always email myself or the clinical trials unit, or do call us. Thank you. Bye for now.